evening, everyone, and thank you for this opportunity. I am Dr. Adarsh. I am a professor of surgery. I practice minimal access surgery and robotic surgery, and I am inventor of P-scope, world's first scope for abdominal cavity examination. Well, the present process of abdominal cavity examination is quite complex. Whenever there is a problem in abdomen, physicians have to first conduct non-invasive tests like an X-ray, ultrasound, CT scan, a PET scan, etc. However, these tests are inconclusive in 30% of the patients. This leads to delay in diagnosis, wrong diagnosis, or misdiagnosis. So patients have to go through second line of invasive tests like a diagnostic laparoscopy or a laparotomy, which is a surgery which is painful, invasive, and expensive. So we have simplified this process. We give a local block on the abdominal wall, a transversus abdominis plane block. This is the device. We introduce the device under vision, and once we are inside, we pump some atmospheric air to make some space inside the abdominal cavity. Then we introduce the device inside, and we can go inside and have a look inside the abdominal cavity. So these are the intestines. If required, we can pass a biopsy forceps, take a biopsy, and release all the gas, take out the port, and the patient is completely awake because this is performed under a local block. So for physicians, it's instant and accurate diagnosis, and its device is portable. It can be used outside the OR. For patients, it avoids a surgery, which means no admission, no general anesthesia, or no pain, or no recovery. So, and it's quick, painless, and convenient for the patients. So one of the examples of its applications in patients in sepsis in ICU, these patients are very sick, they deteriorate very quickly, and there is a sepsis patient which is admitted in ICU. He is on ventilator, dialysis, and inotropes, so he requires urgent treatment. However, we cannot shift him to radiology because we have to disconnect all the tubes and the patient might die on the way. So it's very difficult to diagnose what's going on inside in these patients. So in these patients, we can perform these scopies inside an ICU. We can go inside, have a look, and come to a quick and definitive diagnosis in these patients, and these procedures can be life-saving in these patients. So it adds value to healthcare stakeholders all across. So for patients, it's decreased mortality and fast and quick diagnosis. For clinicians, it improves patient care and familiar technology. For hospital, it lowers cost of care and improves efficiency. So sepsis is the #1 cause of hospitalization in US. Approximately 262 billion is the annual cost of sepsis in US, and 30% of these patients are because of abdominal problems, and sepsis time is critical, and 80% of the sepsis deaths could be prevented if treated in time. So again, it has a very important financial aspect in ICU. Presently, US hospitals lose around 900 million every year on sepsis because every sepsis patient, the hospital gets a fixed amount paid, around 100K is the fixed amount paid. However, these sepsis treatments are very expensive, so most of the hospitals are in red in management of sepsis. However, with our device, if we are able to go in quick diagnosis and quick treatment, we are able to save around 3 days on an average for the sepsis patient. We are saving around $30,000 because it costs around $10,000 per day for a sepsis patient in ICU. Again, we avoid surgeries for these patients, approximately 20K, so we are saving around 50K of saving for every device that is sold to these hospitals. And we also fit in existing reimbursement pathways for this procedure. So our contract manufacturing cost is around $200. We sell these devices at $2,000 with a 90% gross margin. So our initial beachhead market is sepsis, and you see the total TAM for sepsis is around 1 billion, around 540K cases every year, and around SAM is around 350 million. Around 11% of the sepsis are unknown origin, that's our SAM, and the SOM is around 104 million. We are saying around 40% market penetration as this is a novel device and we don't have a competition for this device. So beyond sepsis, it has many other applications in cancer care. to identify peritoneal secondaries, staging of abdominal cancers. Basically, white dots you are seeing are the cancer spots that have spread to the abdominal wall. These cannot be identified by CT, MRI, PET scan, so we can identify with our device, avoiding a surgery for these patients. It has applications in liver biopsy, it has applications in trauma, for example, liver or spleen lacerations, and women's health, and it has some exciting future applications as well. So the total, beyond sepsis, our total global TAM is around $40 billion, and it's an exciting and growing market across the globe. So as of now, we have been already granted our FDA clearance in US. We have granted patents in India and Australia already. Our patents are pending all over the major economies across the globe. So as of now, from 2020 to 2024, we have had an idea development, product development, cadaver studies, secured our contract manufacturers, and 2024 secured our FDA clearance, patents. Now we are raising funds. We have built our core team, and now we are raising funds to get our first manufacturing run and first pilots and a full commercial by 2027. So I'm Dr. Adarsh. I'm a minimal access surgeon with 15 years of experience. I've had three previous startups in medtech, and I saw that there was a clinical problem which was not addressed. So I took up this idea for last 3 years, and we have gotten our FDA clearance last year. My co-founder Thomas is a medtech veteran. He has 3 exits in medtech, and Rachel and Ashley come from a medtech background. They have developed and marketed products. They have launched 7 medical devices in US already. And we have a great clinical advisory board and a business advisory board as well. Thank you so much.